Doug Frederick has had a diverse and seasoned career as a founder, sales executive, investor, and advisor to many organizations. He's the CEO of HealthQues, a health and disease prevention company. Doug, I'm so happy to have you on Liftoff.
Oh, pleasure, Jeannie. Glad to be here.
So, Doug, you've got so much great information. Let's start talking with what is preventative health and why is it important?
It's really important. We spend $4 trillion a year as a country, and 75% of what we spend on major medical is preventable. The chronic disease is preventable. So we should be educating people so they understand what they can be doing. Instead of going to a doctor and finding out what's wrong with them, try to prevent it before that happens.
So, just to make it clear for everybody, preventable health gets it before it even goes to major medical where you have to pay co-pays and other heavy expenses. Right?
Correct. 7 out of 10 times we go to the doctor, we know where we're going. We're trying to get people to use health coaches, call the telemedicine, don't guess what's wrong with you, DNA screening, biometric screening.
And so why is this good for any employer? In other words, what are the benefits that they see?
Well, the benefits they see, statistically happier, healthier employees are going to be more profitable, fewer sick days, and they also get a payroll tax savings by implementing our program.
Oh, wow. I didn't realize that.
Yeah.
That's fantastic.
Yeah.
So every employer should be doing this.
I don't know why every employer isn't doing it, yes.
Interesting. And is it expensive for an employer to implement or?
There's no out-of-pocket costs. We do all the heavy lifting. So it's their payroll company doing the heavy lift, but they already pay the payroll company to do their job. So there's not any more work on the employer or the employee.
And so how does the employee benefit from this? Is it through education, information? What is your company doing with?
Yeah, so we have about a 35% engagement rate, which in baseball, that's really good, batting 350. But that's really high in our type of program. So we're constantly educating, reaching out to the employees. We're trying to get the individuals to, like I said, take a DNA screening, biometric screening, walk through it with a health coach and really understand how you should be eating better. If you're going to exercise, what type of exercising is better for your body.
Now, I know you have a lot of statistics about health and wellness. What are the top 3 preventative health measures people should take?
Number 1, biometric screening. They should get biometric screening for sure. Number 2 would be DNA screening. And then number 3, talk to someone that understands your DNA screening and understands your biometric screening, because you're going to get 30, 35 pages and I didn't even understand mine. So I had to talk to my health coach.
Not ancestry DNA screening, not to find out that you were originally German.
No, we don't do that. It's all about if I'm going to exercise for my body type, what's the best exercise? And really, if I'm going to eat healthier, I did mine for eating and it was low fat. And I thought low fat went out in the 80s, but I guess for my body, that's the type of diet I should be doing. Yes.
That's great. I wonder what mine is. I hope it's high carbs and fast food. I'm going to get mine done. But thanks, Doug, for coming on the show. I think what you're talking about is something every employer should be considering and every person should be considering. Really appreciate having you on Liftoff.
Thank you so much, Jeannie.
All right. Next up, tips to build your personal brand. So stay with us.
What if your personal lifestyle and preventative healthcare was part of your employment? Employers, how valuable is a healthier, happier workforce? What if this could be true for both employee and employer at no additional cost and with an actual realized net pay increase? With HealthQues, these things can be true for both. Many employers face high medical claims and absenteeism costs as their employees don't get the preventative care they need because they don't know where to go, and the out-of-pocket costs for these tests are too high. HealthQues bridges the gap to vital services.